I'm Megan Auten. I'm a family physician at Westchester Health and a member of Northwell Health Physician Partners. And I want to talk to you today about one of the most common topics in my primary care practice, which is getting to and maintaining a healthy weight. Many patients come in wanting to talk about weight loss, and many more tell me that they actually avoid coming in because they don't want to talk about that conversation, and they even want to avoid getting on the scale. For some patients, it's been really a lifelong journey, and for others, it's something that's a bigger issue later on in life. For a lot of women, this becomes an issue, especially after menopause. If this is a topic that you're concerned about, you're definitely not alone. The CDC recognizes that almost 60% of Americans meet criteria for being overweight or obese. Figuring out if you're overweight or obese requires knowing your height as well as your weight, and this allows us to calculate a number that we call the BMI, or the body mass index. There are many calculators online that can help you figure this out. It's also something that we track and monitor every time you come into the office. So we know that a healthy BMI is between 18 and 25. If your BMI is over 25, that's categorized as overweight, and over 30 is categorized as obese. Well, the BMI is not a perfect measure of somebody's health. It does allow us to design studies to figure out how carrying extra weight can impact your health. So we know that there's a wide range of health impacts from carrying a bit of extra weight. Everything from increased stress on your joints, especially your knees, that can cause debilitating pain for patients, to really complex hormonal changes that can cause things like diabetes, heart disease, and even some cancers. There's also a lot of research about how carrying extra weight can impact your mood, leading to or even being a cause of depression or anxiety. So the first thing that I always want patients to understand when they come into the office to talk about weight is that this issue is so much bigger than just your individual willpower. So rates of adult obesity are increasing across the country despite increasing national focus on the topic. If this was just about mind over matter, we wouldn't be calling it an epidemic. It's really a complex health issue that's impacted by social, emotional, environmental, and economic factors. And so talking to your doctor about this health issue is an important first step. The second thing is that most people know that there are so many ways to lose weight. Anybody that's been on this journey for more than a couple months understands that there are countless books and diets out there that claim to help you to lose weight. We know from the latest scientific research that there are a few simple tools that we should stick to when choosing a diet, but the most important thing is picking a program that actually fits in with your life, something that you're able to stick with. Some of the most important themes that you should think about is that it's really consistency and accountability that lead to success when you're trying to lose and to maintain healthy weight. So I ask my patients to think about a time when they've had success with weight loss. Was there a specific program or a diet that helped them to get to that place? And as long as it's following some very simple rules, we can look and figure out whether or not that would impact and help you again at this time. So the best diet choices really follow some simple guidelines. We know that eating fewer processed foods, especially simple carbohydrates and sugars, can lead to the most sustainable weight loss. It's also important to add foods that add nutrition and fuel for your body and for your mind. And so sometimes focusing on what you can add to your diet, like always leafy green vegetables, can keep the focus a little bit more positive than when focusing on what you're cutting out every day. So it can be a good idea to keep a food log, not a calorie count, but just a list of the things that you're putting in your mouth every day. In addition, I urge patients to get on the scale a little bit more than just once a year when you come in for your checkup. We don't want months or years to go by without knowing how the choices that you're making every day are impacting your health. So these steps can be really hard for some people. It's important to know that it's not about judgment or about punishing yourself. The scale really doesn't care how much you weigh, but instead it's about putting steps in place that can increase accountability so that you stick with the program that you've chosen. Finally, it's really important to understand that there may be some issues underlying why we eat. High stress, boredom, sadness, and other negative emotions can have a really big impact on what we choose to eat and when we choose to eat it. This might not be true for everybody, but talking to your doctor about ways to manage high stress in your life can have a really big impact on protecting your health. So I urge everybody to talk to your doctor about steps that you can take to get to and to maintain a healthy weight. It can go a really long way in protecting your health.